Let's discuss about the rehabilitation part of ACL surgery. So before we think of any surgery, what are the prerequisites? That whenever we think of doing surgery for someone who has ACL tear, there are three things we should see. One is that his or her knee should be able to be made straight, that is called complete extension, and the knee should be able to be bent completely, that means complete flexion. Person should have complete range of movement, that is 0, that is extension, to 140 or 150 degrees of flexion. Second thing, his or her knee should not have any effusion, that means the knee should not have any much swelling. So normally there will be some swelling after ACL tear. So with 1 week, 2 weeks or 3 weeks of time, the swelling would have come down. Once the swelling is not there, that is when we should think of doing ACL surgery. The third thing is, person should be able to straighten the knee with his muscle effort so that the knee should not be in lag. That means whenever someone tries to extend the knee, this knee should come to full straight. If this muscle is weak, then the knee will not come to complete straight. It will be like 10 to 20 degrees of flexion. That is called extensor lag. So if this extensor lag is there, then person should be sent to prehabilitation, that is muscular strengthening exercises, before we think of doing ACL surgery. These are the three prerequisites to see if that person is a right candidate or in right time to think of this surgery. After we do this ACL reconstruction, what are the post-surgery rehabilitation? We discuss this as end of first week, end of second week, between third and fifth week, 6 to 8 weeks, 12 to 16 weeks. First thing is end of first week. By the end of first week after ACL surgery, three things you should see. How much active knee flexion, that is knee, so this is 0, this is 90 degree. So we should be able to bend the knee up to 90 degree. This muscle, quadriceps muscle, that is a thigh muscle, should be able to contract and relax, contract and relax. And person should be able to lift the leg straight without lag. These things we should be able to achieve at the end of first week after ACL surgery. How we are going to achieve this? Wall slides means bending and straightening. Patellar mobilization, this contraction relaxation of this bone, bending and straightening of the knee, and icing to control the swelling. Gait training, person should be made to walk with a support, with the knee brace, with a walker. We can ask them to put partial weight to complete weight by the end of the first week. However, knee brace should be worn all the times, even while sleeping, and only when making them to do exercises, then only those times they have to remove the knee brace. That is extension knee brace to be there all the times. Knee bending, straightening, 0 to 90 degree. This patellar mobilization and contraction of this quadriceps muscle, control of the swelling, to be able to walk with a support. These are all the things they should be able to achieve by the end of the first week. Person should be able to bend 100 degrees of knee flexion. This is 90, slightly more than 90 degree by the end of second week, 15 days. By the end of the 15 days, person should be able to bend 100 degree. He should be able to climb the stairs. Reciprocal stair climbing means one leg on one stair, reciprocally, each leg on each stair. They should be able to climb the stair, of course with the railing support. And they should be able to achieve complete straightening of the leg, straight leg rising, without any knee lag. If there is any lag, if there is any swelling, if there is less than 100 degrees of flexion, then what are the things we are going to do? That is the goals. Goals are reciprocal stair climbing, 0 to 100 degrees of knee flexion, no extensor lag, and gait training, able to walk without support on the flat surface. These are the goals. So what are the exercises? So exercises are knee flexion extension, quadriceps muscle contraction, prone hands. Two things which I am going to tell you which are very important. If someone is not able to get complete extension of the knee, zero, he is not able to do. If knee is little bent like this, while sleeping or while walking, if they struggle to walk with to make knee fully straight, if knee is not made fully straight, that means this muscle, quadriceps muscle, is not contracting. The simplest way to do is prone hands. Person should be made to lie down prone on his tummy and leave the leg outside the bed so that this leg is like made to extend based on the gravity. So this prone hang is very important to get complete extension of the knee. If they are able to get complete extension, whereas flexion, bending is restricted, limited. That means patellar mobilization is to be made. These two things. If person is not able to completely extend the knee, prone hangs are to be done. Person is not able to bend more than 100 degree, then patellar mobilization. So these two things are very important by the end of the second week. Rest remains the same. Quadriceps muscle exercises, gait training. You can discontinue the walker or stick after the 2 weeks. However, knee brace has to be worn even while sleeping after 2 weeks. Then what we'll do after 3rd to 5th weeks? Person should be able to bend more than 100 degree, almost near normal flexion. Knee flexion should be able to make almost normal. Then quadriceps muscle, this muscle strength to be about 60% of the normal leg compared to the other side. Then what are the things we have to do? Intervention, that is cycle exercises. We can introduce bicycle exercises. We can introduce half squats, that is quarter squats or half squats. So leg to be on the ground, knee bend is made to bend. So this is a closed chain exercises. You should recommend closed chain exercises than open chain exercises. So the details of closed and open chain you can find out. So closed chain exercises, half squats or quarter squats, cycle exercises, and normal walking without support can be made by 3 to 5 weeks. After 5 weeks, that is after 1.5 months, 6 to 8 weeks, what are the things to be done? By the end of 1.5 months to 2 months, we have to do whatever we have told before. If they have not achieved all these things, if there is any restriction of flexion, not able to completely extend, then this is a time you have to focus on continuous passive mobilization or manual flexion and extension by the therapist, by the help of the physiotherapist. They have to be made to get good range of movement if they have not achieved even now. At the end of this 2 months, 2 to 3 months, there should not be any effusion. There will not be any effusion. Quadriceps muscle strength is about 80% of the normal. Full range of movement, and they should be able to walk normally by 2 months. This is the time they can start climbing, start driving 2-wheeler or 4-wheeler. 2 months to 3 months, they can start slow jogging or cycling and intensive weight training. However, open chain exercises are not to be started. Aggressive open chain exercises, closed chain exercises are to be continued by 3 months. Then after 3 months, end of 3 months, 4 to 6 months is a time sport specific training, single leg hops and continuous training for the running or jogging can be made. Then comes the sports specific training or strengthening of the muscle based on the needs of the particular patient is made. So this can be followed by a physiotherapist or a specific sports training center. You would have started driving 2-wheeler, 4-wheeler, cycle, everything by this end of 3 months or 4th month starting. However, sports training getting back to sports, cutting or pivoting activities or football or those sporting activities, contact sports, to be made after 5 to 6 months. But before going this hop test, single leg test, then all of these things you should be under the care of some specific sports trainer. But till now, what I told you is for the regular recovery after the surgery. Furthermore, is based on the particular needs of the patient. Of course, based on their particular sports, training may be different after 3-4 months. But first 3 months is same for most of these people. However, this differs if there is any other ligament injury like meniscus injury or any other particular ligament like a PCL or ACL or MCL injuries. Slight modification in the rehabilitation will be there, but the basic concepts remains the same. I think you have understood something. This is useful to you. If you find it useful really, then please subscribe to my channel, share to your family and friends. Don't forget to click bell icon. Thank you.